Welcoming a baby into the world is a lovely experience, but it can also be too much to handle. Are you confused about what you really need to take care of yourself and your baby after giving birth? We're going to cut through the noise in this video to show you the 10 most important things that will make your transition easier and more fun. Want to know if you've thought of everything? Keep watching to find out what you need to do to get ready for this amazing trip. Number 10. Extensive pads. Both at the hospital and at home, but it is necessary to have it. The amount that you require is as follows. The hospital will keep you stocked while you are there, but you should also have at least 1 or 2 packages at home to begin with. Why? The wonderful news is that you are no longer pregnant. The bad news is that you are about to endure postpartum bleeding, which will cause you to go through the most difficult and lengthy phase of your personal life. A substance known as lochia, which is a mixture of blood, tissue, mucus, and fluid from your uterus, will be passed out of your body, and it may last anywhere from 6 to 8 weeks. During the first week or 2, it will be rather heavy, but after that, it will gradually become more like spots, and then it will completely go. The thickest, longest, and most full coverage maxi pads that you can get will provide you with the most comfortable experience while you are wearing them. Number 9. Mesh underwear. For when you require it. After spending many days in the hospital and then at home. When you go to the hospital, you will be given 1 or 2 pairs of inexpensive shoes, but you might want to purchase anywhere from 3 to 5 more pairs so that you can have them waiting for you when you come home. The reason for this is because mesh underwear is a godsend after giving birth, since it can stretch beautifully to accommodate the aforementioned enormous maxi pads as well as all of your postpartum bits with comfort. It is a disposable product that provides you with support without digging into your skin, squeezing, restricting, or squishing your soft abdomen and sensitive parts in any manner. It is also really comfortable. Your healthcare provider will provide you with a few pairs of mesh underwear while you are there, but if you believe that you might like to continue wearing mesh underwear for longer than the initial couple of days, it is a good idea to purchase a package for yourself as well. Number 8. OTC Pain Relievers. What you should know about your postpartum body over-the-counter pain relievers when you are in need of them, while in the hospital and while at home. Quantity that you require, the hospital will administer it while you are there, but you should bring your own supply of the medication with you. The number of doses that are required to get through the first 5 to 7 days after labor and delivery. As a means of alleviating the discomfort associated with a cesarean section or vaginal birth, the majority of hospitals will prescribe you an extra-strength ibuprofen regimen after you have given birth. That is something you may continue to do at home, or if you would rather, you can switch to acetaminophen. An additional benefit of pain medications is that they can help alleviate the discomfort associated with postpartum cramps, which occur when your uterus begins to return to its normal size. Number 7. Perineal numbing spray, when you need it, for the first 5 to 7 days after giving birth. Perineal numbing spray throughout this time. There is a possibility that you will not receive any from the hospital. Thus, it is important to ensure that you have at least 1 bottle in your delivery bag and 1 bottle at home. You could disregard this recommendation if you are going to have a cesarean section. However, if you are going to have a vaginal delivery, and especially if there is any tearing, you will require a topical anesthetic that can be sprayed directly onto your vagina in order to experience the sweetest postoperative relief possible. Your pelvic region has just been through something that can be described as a traumatic event. It will take some time for it to heal, but in the meanwhile, it will provide you with discomfort. The use of numbing spray will be beneficial. Number 6. Perineal squeeze bottle. For when you require it, for the first 5 to 7 days and after giving birth, there is a possibility that you will be given a period bottle to take home from the hospital. However, you could only require 1 of these bottles. The reason for this is that after giving birth, you should not undervalue the usefulness of this little plastic squeeze bottle. In the event that it is filled with warm water, it will make the entire procedure of urinating after giving birth significantly more comfortable. After giving birth, the perineal region of your body is not only painful, but it also has the potential to become dry and crusted over with lochia. Urinating may become a chore as a result of this. Nevertheless, a perineal squeeze bottle may be of use. It is recommended that you squirt a small stream of water all over your perineal region both before and after you urinate in order to cleanse, hydrate, and soften the area. Number 5. Stool Softener. When you require it, as soon as possible. The quantity that you require is sufficient to consume between 1 and 3 capsules on a daily basis until you resume having regular bowel movements. Once you have given birth to your child, you may believe that all of your efforts have been completed. But if you have not yet experienced a postpartum bowel movement, you are not completely free of any complications. Beginning the process of preparing your bowels for a movement as soon as you give birth is the simplest method to make this experience less of a challenging one. Stool softeners do not cause you to vomit. Rather, they make it simpler for you to expel the contents of your bowels. Instead of relieving constipation, they are most effective as preventative measures. To put it another way, begin taking the softeners before you first experience constipation, and with any luck, your first bowel movement after giving birth won't be as difficult as the labor itself. Number 4. Nursing pads. When you require nursing pads, you can use them at home. In terms of quantity, you will require either a couple pairs of washable pads or a box of disposable pads. You will begin to experience milk production approximately 48 to 72 hours after giving birth, regardless of whether you intend to breastfeed or exclusively pump your milk. Additionally, you will experience leaking prior to feedings as well as in between feedings, in the event that you do not wish to change your clothes twice as frequently as you would be anyhow thanks to diaper blowouts. You will require absorbent pads to be placed inside your nursing bra. Number 3. Nursing bras or tops. For when you require it, having it at the hospital is a nice perk, but having it at home is an absolute necessity. As many as you will require in between loads of washing is the quantity that you will require. In reference to nursing bras, you will require a couple of these, and it is likely that you will also require a few tops that are suitable for breastfeeding. These do not have to be specifically made nursing tanks or shirts. Button-up shirts or cardigans, pullovers with zippers, or sweaters with deep V-necks are all acceptable options in a pinch. However, nursing camisoles, which can be easily fastened or unfastened from the straps, are an excellent investment. You should make sure that you have enough to rotate between washings and all of those quick changes when the baby spits up all over you, regardless of the option that you choose. Number 2. Nipple cream. When it is necessary, nipple cream can be found at home. There is a minimum requirement of 1 tube for you. Why? Both nursing mothers and mothers who pump their breast milk exclusively are likely to end up with nipples that are very painful. It is highly likely that your nipples will be rubbed raw on a regular basis until they have become accustomed to breastfeeding, and it is also possible that they could crack. Nipple lotion, particularly creams containing lanolin, will alleviate a great deal of discomfort in your breasts. The use of lanolin not only prevents further injury to your nipples, but also helps to heal any irritation that may have occurred. Number 1. Witch Hazel pads. At home when you require it, which Hazel pads are available? How much you require? It is recommended that you choose for a jumbo-sized tub. Why? Witch Hazel is a miraculous substance that can be used to your face to treat acne, your bottom to alleviate hemorrhoids, and your vagina to alleviate the burning pain that is left behind after giving birth. In addition, considering how unpredictable postpartum hormones can be, it's possible that you'll require it for all 3 of these reasons. If you want to reduce swelling and inflammation, you should stock up on Witch Hazel because it is so effective at doing so. In the case of hemorrhoids, a light application performed several times daily, particularly after bowel movements, provide you with the much-needed relief you require. You can alleviate vaginal pain by placing a couple of Witch Hazel pads on top of your maxi pad and then replacing them as they become dry. This will allow you to use the maxi pad. As a helpful hint, you should store your Witch Hazel pads in the refrigerator so that they remain cool and comfortable. Have faith in us on this one. If you found this video helpful, don't forget to hit the subscribe button and ring the bell so you never miss out on more tips and advice for your parenting journey.